Hi, I'm Scott Margolin, Vice President of Technical here at Tyndale, with another in our ongoing series of COVID-19 safety alerts. Today's subject does not involve arc-rated or flame-resistant protective apparel. This one is purely on how you can evaluate risk and evaluate what is safe and what is not and what is in between as we start to venture back out as the individual counties and states open up a little bit. So as we do that, I want to emphasize I am not a medical doctor. However, in my role at Tyndale for the last 12 weeks, almost all I have done is study the various reports, scientific analyses, medical data that's come out on the virus to help keep our customers safe. And we're going to present where those physicians agree. They don't always all agree all the time on everything, but what you're about to see are the areas that there is an absolute majority consensus. So what are we talking about here? Viruses are not alive in the traditional sense of the word, so you can't kill them. What are they? They're not bacteria. They're not single-celled organisms like you would see through a microscope way back in high school. They are individual virus particles. A virus particle is called a Viron, and they're a submicroscopic infectious agent. Really, what they do is hijack a living cell to replicate themselves. They can't replicate outside of a living cell. So they need to get inside that living cell, and then they'll replicate, and in doing so, you can end up with an infection and all the negative consequences that come from there. So why is this a novel coronavirus? Well, there are other coronaviruses out there. In fact, 4 of them are responsible for the common cold. This one is new, hence the name novel. So a lot of the early information, if you're concerned that what I hear today is different than what I heard yesterday, which is different than what I heard last week, there's a reason for that. It's a new virus, or at least new to science. And so a lot of the early information was predicated on what we knew about existing coronaviruses, SARS included. Much of that is true of this one, some of it is not. So science and medicine are learning on the go. So what are the terms? Let's define the terms here. You've heard different terms. The virus itself is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. Fun bunch of words to say. The disease it causes is called COVID-19. So the virus itself, the virus particle, SARS-CoV-2, the disease it causes is COVID-19. So I'm sure seeing many pictures like this one, or even scarier. It's a spiked ball, and that's going to become important. If we want to destroy it, we want to avoid it, we want to minimize contact with it, it's helpful to know what it is and what it can and can't do and what will and won't destroy it so we can stay safe out there. So it's important to understand that it has a lipid shell and some genetic material inside there, and that's the dangerous part. So let's take a little closer look at that. The red spikes are the protein spikes on the shell there. And what they do, I'm oversimplifying, is they are what allow it to attach to, in this case, a human cell and do bad things. So that's sort of the docking mechanism. The yellow and orange and beige circle you see there, that's the lipid ball. Lipid is important. You may already be familiar with that term, but it basically means something fatty. And that is important to what we can do to destroy the thing. And then inside that lipid shell, that's where the dangerous stuff is. It gets into one of your cells, hopefully doesn't, and uses that genetic material in there to replicate itself, and that's where the danger lies. So we want to avoid infection, obviously. What does infection require? Something called the infectious dose. That's the amount of virus particles, or virons, which are required to trigger the disease. And interestingly, that differs virus to virus and even person to person, depending on things like your immune system at the moment that you become infected, or potentially become infected, become exposed to the virons. With something like the flu, some medical information says it can be as few as a handful, 3, 4, 5 individual virons, or up to thousands. And the early estimates for SARS-CoV-2 are about 1,000. So you need about 1,000 particles, we think, to have an active infection occur. Less than that, and your body probably fights it off and you do not become infected. It is also possible, not certain yet, that higher initial infectious doses are part of what contribute to the severe cases. So obviously you don't want to get infected to begin with, and the more you're exposed to, if it's also related to the severity of the subsequent illness, is an important thing to know about. So the dose that you get, that infectious dose, is dependent on both how much is present where you are and, of course, how long you're exposed to it. Those 2 things are going to become very important, and you'll hear me mention them a lot moving forward. Now, Dodgeball. I don't know how many of you have seen the movie Dodgeball, and it's probably not wise of me to bring up a comedy on a subject as serious as COVID-19, the illness, or SARS-CoV-2, the virus that causes it. But I think it helps a little bit if you're familiar with the movie. There's the 5 Ds of dodgeball: dodge, duck, dip, dive, and dodge. It's a little bit of a joke in the movie, throughout the movie. That's very relevant to this illness because, in my personal point of view, if you look at all the things that the scientists and the medical professionals are saying, there are 5 Ds of COVID-19. And understanding those 5Ds and keeping them in mind as you move out into public and evaluate what's risky and what's not and what's in between will really help do that. So let's take a look at what I call the 5Ds of COVID-19. The first one is distance. We all know about social distancing, and I want to emphasize 6 feet is a minimum. Doesn't mean you start at 6 and creep into 5 and 4 and 3 as you get comfortable. 6 is a minimum, and it should be greater than that depending on other things in the environment at the time, such as dosage. The dose matters. How much is being put out by the other person that may be infected is a major issue, and the more that's being put out, the more distance you need. So we'll talk about that a little bit later. Dilution matters enormously. What does that mean? Well, if you're in an elevator with somebody, there's no room for that to dilute. If they're ill, when they're breathing out or coughing out virus particles, where's it going to go? All right, now let's say you're in a conference room. Well, that's bigger. There's a little more room for it to dilute. Or now let's say you're in a big box store, like a Lowe's or a Home Depot or a supermarket or a Walmart. Well, there's an enormous amount of room for that to dilute. Or let's say you're outdoors, infinite. So dilution matters enormously. So does duration. Again, the longer you're exposed to it, the worse it's going to be. You may not receive an infectious dose in the first minute or the second minute, but if you're still in that situation 30 minutes later, you may have. And the last D is disinfection. So the first 4 involve respiratory things that you can choose to be more or less exposed to. Disinfection involves what's called fomite transmission, which is when you touch a surface that may have particles on it, like a doorknob or a faucet or a light switch, and then touch your nose or mouth and transfer those virus particles into your system that way. Those, in my view, are the 5Ds of COVID-19. If you keep these in mind and the interrelationship between them moving forward, you'll be much more well-equipped to evaluate what's risky and what's not. So let's take a quick look at the statistics. A lot of people are understandably very frightened by this disease, but let's put it in perspective. Even if you have symptoms sufficient to get a COVID-19 test, you should be aware about 80% of those tests are negative. So even if you have the symptoms that are appropriate, such as a fever and a dry cough, you're probably not going to be diagnosed with COVID-19. And of the cases that are confirmed, and it's now 1.6 million, that's how rapidly it's going up, not all that many people are actually hospitalized unless you're over 65 years old and or you have several underlying conditions. So 80% of the cases that get tested don't even have it. Of the ones that do, the vast majority do not require hospitalization. There are some sources now beginning to suggest that up to 10 times more people have been infected with COVID-19, with the SARS-CoV-2 virus, and gotten COVID-19 than we're aware of. And if that's true, then the vast majority of the cases are so mild that they don't go to a physician or they're even entirely asymptomatic. If that's true, it's very good news for both the fatality rate and the hospitalization rate because it would divide them both by 10. Now, how about age? Age, as we all know by now, is a major factor here, unfortunately. If you're under 30, only 2% of the people who catch this illness end up hospitalized. If you're between 30 and 50, it's about 5%. If you're over 65, it's about 10%. So as you can see, it goes up with age. It's a major risk factor. But even then, the vast majority of people, the older people, don't require hospitalization. And about 80% of those hospitalized will eventually recover. Now, the fatality rate, based on the total confirmed cases right now, is about 6%, and that also goes up with age. So let's take a look at that briefly. The exact numbers vary by source, of course, but they're pretty similar. Comorbidity means you have another underlying condition, which we've all heard a lot about, diabetes, obesity, asthma, high blood pressure, other things, heart conditions, and things like that. So at least 94% of the fatalities have at least one underlying condition, and 88% of them have 2 or more. So as you can see, the significant risk of fatality is really among much older people with other significant underlying illnesses. As you might imagine, a related point, about 70% of the fatalities thus far have been in nursing homes and assisted living facilities and places like that. Another unfortunate linkage, if you're a male, to fatality is men. Males are more likely to die of this illness than females. And the last item here, waiting too long to seek medical care, that's unfortunately stereotypical of men, and that may somewhat explain the previous bullet. But please, if you have symptoms that you think are even remotely consistent with this illness, don't wait to seek out medical care. Taking your temperature is an excellent early indicator of that. So, all right, we take a look at what it is and what the real risk factors are and the data that are out there. How is it spread? It helps to understand how it's spread and how it's not, to know what's safe and what's not. The vast majority of this, as far as science understands today, is spread person to person by droplets that are exhaled, coughed, or sneezed out. Now, there's some data beginning to come in that says it's maybe possible that aerosolized transmission can occur outside a hospital. Aerosolized is not a heavy droplet that falls to the ground within a few feet and a second or so, but is potentially tiny particles that can remain suspended in the air for minutes or hours after someone exhaled them. That would be extremely scary. Right now, that is not what the CDC is saying. They're saying droplets exhaled, coughed, or sneezed out. So again, these droplets are large, they fall quickly. As a result, they don't go very far. That's where social distancing comes from. If you are 6 feet apart or more from somebody who may be talking or breathing around you and they're infected and these particles are coming out, the vast majority of them are likely to fall to the ground before they reach you and you inhale them and get that infectious dose that we talked about, except if that person is coughing or sneezing. Coughs and sneezes can be projected much further. So again, that 6 foot social distancing is a minimum distance, not a maximum or a perfect number. Now, there's also the possibility here of fomite transmission, which is surface to person. I mentioned that a moment ago, where you touch a surface like a doorknob that has virus particles on it and transfer them to your mouth or your nose, and it can become infected that way. Now, there are various reports out there about how long the SARS-CoV-2 Viron can remain viable. It's not alive again, but can remain infectious or active on a non-living surface. And much of that data says it's hours or up to a day on porous surfaces like cardboard or fabric, and much longer than that, 3 days, and some reports even suggest 7 days on harder surfaces like metal and plastic. Now, just because a virus can be detected doesn't mean it's infectious, and that's an important thing to know, and we just don't know yet. This virus is too new. Then anyhow, what you don't want to do, so this is where the disinfection of the 5 Ds of coronavirus comes in. What you don't want to do is touch surfaces in public that may be contaminated and then touch your face. We've all heard for a very long time now about washing your hands and why that is. So who do we want to avoid now that we understand how it's being transmitted? The vast majority of the transmission is person to person via droplets, so proximity matters and duration matters. There's another aspect here. The vast majority, some reports say 90, some say 99% of all transmission is by less than 20% of people who are known as super emitters potentially. A lot of folks shed most of this virus within the 48 hours before they're symptomatic. And so that's part of what's so frightening about this. You can't look in public and identify that person's a risk and that person's not, except of course with coughing or sneezing. And it can be days or up to 2 weeks before the symptoms show. So that unfortunately leaves a long time where that person could be unaware they're ill and out in public. So as a result, some people are riskier than others, but other than coughing and sneezing, you really can't tell. So if it isn't obvious, what do? Well, we have to look for other things to keep us safe besides identifying visually who is safe and who is not. And we can start to do that now. So coughing or sneezing were obvious. You didn't need me to tell you that. But things like yelling or singing, believe it or not, especially indoors, are also significantly increasing your risk. So let's take a look at that. This is where the rubber starts to meet the road with the 5 Ds of coronavirus, of COVID-19. So let's be careful to take a good look at this slide and make sure we understand it. Dose and duration are enormously important. So if the threshold is about 1,000 virons plus or minus to get infected, obviously 1 or 2 won't do it. So if you're breathing through your nose, the various activities that people can be doing if you're around them, they're going to be breathing through their nose or maybe their mouth. They might be talking. They might be yelling if it's a sporting event or indoors someplace cheering for something, or they might be singing, coughing, or sneezing. So you can see as you go down the list, breathing through your nose will emit about 20 virus particles per minute if someone's infected, and they'll go about 1.5 feet. All right, well, you can be around somebody who's infected for a while and not get 1,000 virus particles. Even if you breathed in everything they were breathing out in, you almost certainly wouldn't. What if they're mouth breathing? Well, mouth breathing puts out a few more virus particles and it puts them out a little bit further. So it's a little bit riskier to be around a mouth breather than it is a nose breather. Talking puts out, believe it or not, according to most reports, about 10 times as many particles, droplets, as does simply breathing. And it projects them a little bit further. So about 200 virus particles per minute, virons per minute there. So you can see that if someone's talking suddenly, you can be around them a lot less time if you're close before you've received that infectious load. Yelling or singing put out even more. They're louder. So both they're going to be drawing from deeper in the chest and putting out more particles and projecting them further. And if the environment that you and they are in is louder as a result, you and they and others will be talking louder as a result. And it's a little, unfortunately, little vicious cycle there that pushes the risk up. And then coughing 3,000 drops and 50 miles an hour can go 12 feet. Sneezing, 40,000 drops. Each of those drops containing countless virus particles called virons can go even further. So, all right, now we've looked at what people can be doing around you that's risky and the relative risk. Let's take the duration in. So we saw the dose. Duration matters as every bit as much as dose does. If someone's putting 20 particles out a minute and you're breathing them all in, it takes about 50 minutes to get infected. So if you're simply next to somebody, foot and a half away for an hour, and they're nose breathing, you might become infected. That's a pretty long time though, which is why duration matters. What about mouth breathing? Well, a little less time. Not entirely sure how much at this point. If they're talking, however, watch what happens to the duration. If it's 10 times as many particles, it's 10 times less time. So you really don't want to be 2 or 3 feet apart, face to face with another person while they're talking if neither one of you is masked up. The duration matters enormously. As the dosage goes up, the duration tolerance goes down if you want to avoid that infection, right? Pretty basic math. Yelling and singing, even worse, a little bit less than 5 minutes for yelling. What about singing? Nobody knows, but one of the classic super spreader events where enormous numbers of people, and it was in the high 40s out of 60-ish people present, became ill at a church choir a couple of months ago in the Pacific Northwest. Coughing, obviously, and sneezing can be seconds, could be a single cough or a single sneeze if you're unfortunately close enough, or if you're 6 feet away instead of 2 feet away, it might be 2 or 3. So you can start to look at the risk scale, the safest places and the least safe places, dosage and duration, now that you understand, hopefully, what's riskier in the scale here. Nose, mouth, talking, yelling, singing, coughing, sneezing. If you don't like those kinds of charts, there's another way to look at it. Your probability of becoming infected is a function of the exposure to the virus, which is on the left-hand column there, and the duration of that exposure on the right. Not exactly rocket science. The takeaway here, some interactions are much riskier than others, and as you begin to venture out in public, you need to make educated decisions about what's what in this regard. So let's assume for a moment no masks, and I hope you're all wearing masks. We'll get to that. 1 cough or 1 sneeze. The dose is high and the distance is short. You can get infected quickly. If you're around people that are singing or talking, the dose is also high, not as high as coughing or sneezing, but high, and you might only have minutes before you become infected. So if I'm walking into a place, there's other people there and there's a decent volume of air and it's pretty quiet, I have a reasonable degree of confidence, especially with a mask, that I'm safe for a while. If I walk into that place, I expect it to be quiet and it's loud, I'm making a different decision. I'm going to vote with my feet and I'm going to leave. What about talking face to face? Well, that's probably just fine a few feet away for a minute, but it's probably not fine for 5, 10, 15, 20 minutes. The closer you get, the shorter the duration. The further apart, the longer the duration. Masks help enormously, so be very careful with these things. One of the reasons that people wonder, why aren't so many people infected on an airplane? Typically, they're not sitting face to face, right? They're sitting facing in the same direction. And there's typically, these days, very little talking on an airplane. So there's not a lot of projection of virus particles. And that air is both mixed with outside air and goes through a HEPA filter. So, it's one thing to be on a half-full airplane where everybody's quiet. It's another thing entirely to be on a packed flight where everybody's talking, yelling, laughing it up, partying it up. They're completely different, even though the environment is the same. So once again, dosage is dependent on how much is present and how much you breathe in. So what are your friends here? Dilution and distance and masks. What I mean by that is there are certain things you cannot control. What those other people are putting out is something you can't control. But how far away from them, you can. How long you're around them, sometimes, most times, you can. And dilution, you can. If there's an event you can choose to hold outdoors instead of in, do it. If there's an event you can choose to hold in a big room instead of a small room, do it. Those things help. Outside is far safer than indoors, again, due to the infinite level of dilution that can occur and the air movement that occurs, and also UV. There is now reasonably compelling evidence that ultraviolet light, as science had suspected all along, will deactivate the COVID-19, the virus that causes COVID-19, SARS-CoV-2, very, very quickly in a matter of minutes on a sunny day and potentially as many as 14 minutes on a cloudy day. Humidity is also thought to help reduce, because the air is heavier, reduce the distance that these droplets can carry and the time that it takes for them to fall to the ground. So outdoors is your friend on every level. If you have to be indoors in public, Bigger spaces are better, as are high ceilings and good ventilation. You want maximum outside air coming in there. If you're in an indoor facility and you have to be in there with other people and you can open the windows, I know it's getting hotter out, do it. Ventilation and dilution are your friend. The fewer the people, the better. If you can put half the number of people in a room, your risk is cut in half, both with regard to the likelihood that somebody in that room is infected and the amount of virus that you'd be exposed to if you did that. Again, also quiet is better than loud. If you have to be in a conference room or in a conference area with people, but they should be encouraged not to talk any more than they have to, and they should be encouraged not to talk any more loudly than they have to. And this is something I'm sure you'll all be happy to hear anyway. Meetings should be as short as possible. Don't linger. Duration matters. All right, so let's turn from the respiratory to the 5D of COVID-19, fomite transmission, or fancy term for touching surfaces. So we've talked about this already. We now know that it can remain viable on some of these surfaces for at least a couple of days, and some people are now saying as many as 7. So we know the risk, your hands touching your face. What can you do about it? Well, first of all, you should know that although sanitization routines are incredibly important here, right now the best medical information says that probably less than 10% of all transmission is by these methods. So when you think about what you should be doing out there, a lot of your effort right now is probably put into sanitizing because it's easy relative to having to wear a mask or worry about what kind of a store you're in. But 90% of the transmissions are occurring out there by respiratory methods, not by fomite transmission, as far as we're told at the moment. So take that into account. What can you do about it? Don't touch your face. You already knew that. It's hard to do. It's very difficult to train yourself to stop touching your hands to your nose and mouth. So wash your hands as often as possible, especially immediately upon returning from any public space. Hand sanitizer in your car or washing them in your house. Disinfect frequently touched surfaces. Do you need to disinfect everything all the time? Probably not. It takes a decent number of these Virons to infect you. So touching something that one other person touched briefly, like a paper bag or a plastic bag from the market, is unlikely to carry sufficient viral load. However, touching something that 100 people touched that day, like a doorknob or a light switch, might be. So frequently touched surfaces, it's wise to sanitize all the time. We'll talk about why masks can help again in a minute. So, all right, where are people getting this? As I start to leave my house, what's safe and what's not? What do the statistics tell us? Well, unfortunately, they tell us that about 80% of the transmission right now is in the home from another member of the household. Well, that's where you're quarantining, so I don't know what any of us can do about that. So putting that aside for a minute, where does that member of the household get infected out there and bring it back to the household and infect others? Well, perceived versus actual risk can be important here. And what do I mean by that? Frequently, what we perceive our risk to be is what we focus on when the actual risk is something else, and that's dangerous. So I'll give you a silly example. I'm known for liking to swim with sharks. It's just my thing. I'm a diver, and that's what I do. Many people, when they go to the beach or they fall, if they're in the ocean swimming, their first concern is sharks. If you're on a boat and it sinks, the vast majority of people who end up dying as a result of that mishap aren't hurt by a shark. They either drown or they become hypothermic, which results in drowning as well generally. So what is the risk? Is it sharks? No, it's hypothermia or drowning. But what's in our mind, thanks to a movie in 1974 called Jaws, is sharks. So perceived versus actual risk is relevant here. So understand this, the biggest outbreaks by far outside of nursing homes are in prisons and places, unfortunately, now this is where it starts to get sad for those of us who want to return to a normal life. Religious ceremonies are unfortunately a major contributor. Half the cases, I believe in South Korea, are attributed to an individual service at a church there, at a religious facility there. Also, meatpacking plants, you've heard that in the news. Call centers, not necessarily in the United States, but overseas, absolutely. Weddings, funerals, and parties. So what do they all have in common? If you think about that for a minute, now that we know where the super spreader events are occurring, what do they have in common? What they have and trade shows and business gatherings, I forgot to mention. What they have in common is they're all indoors. They all bring a lot of people in close proximity for a long time. Think about all the 5Ds of COVID-19 here. So they're people in close proximity for a long time indoors, and there's talking or singing or yelling. Meatpacking plants are very loud, so you have to get very close, the distance factor, to be heard. And then you have to yell to be heard, and you have to stay there to have that conversation. Religious ceremonies, people sitting shoulder to shoulder, row after row. Typically, everybody's talking in a call and response or singing or whatever. Weddings, funerals, parties, what are people doing there? The same thing. They're together indoors for a couple of hours, socializing, touching, without masks. So these things are all what cause super spreading events. And that starts to help you understand your risk. So what they have in common, again, if it's indoors with poor air circulation and a lot of people, use your feet and leave if you can. If there are lots of people talking on top of everything else, or singing or yelling, even worse, leave even more quickly. So the main sources of infection here, right, we've just mentioned, and let's talk about restaurants as well in a moment. What they have in common is there's little or no distancing, very poor dilution, long duration, high dosage, and no disinfection. In other words, somebody else has touched, the silverware and you just did. Somebody else has touched the doorknob to the restroom and you just did. Plus, of course, people weren't wearing masks. These events all happened, at least in this country, before people were wearing masks. So in evaluating your risk moment to moment, keep these things in mind. These things matter a lot. All 5 of the Ds of COVID-19 are violated in these super spreader events. No distance, no dilution, long duration, no disinfection, right? Not a good scenario. So understanding your risk as the country reopens, I would urge you to constantly evaluate any discretionary activity. Do I really need to do this? Do I really need to do it now? How risky is it? What is your risk? Your risk, again, is the exposure that you are suffering times the amount of time that you're suffering it. What goes into exposure? Again, how far you are away from somebody, what kind of dose they might be putting out. Are they nose breathing, mouth breathing, singing, yelling, talking, right? And the dilution factor, outdoors, indoors, big space, small space. So I'm going to be constantly thinking about whether I'm outside or inside, if I have to be somewhere. How many people are in there? Hopefully the market in your area is limiting the number of people that can go in for that very reason. How easily in this environment can I maintain distance? That's going to become very important. Sometimes that's in your control. Sometimes it's not. If it's not in your control, I'd be voting with my feet. And then how much do I trust others in that environment if I have to be indoors to be doing the right thing? There are different levels of common interest with people that you might be with. You have next to no common interest with someone at a market, but you have an enormous amount of common interest with somebody you share office space with, right? So these things all matter. If I'm going to be indoors, I'm going to make sure it's the biggest space possible. It's well ventilated. It's high ceilings. There's not a lot of people talking and not a lot of loud activity that requires them, if they're talking, to be talking loudly. So in the workplace, people have gotten used to working at home and they may be resistant to going back, and that's understandable for a variety of reasons. The workplace would typically be now, today, not 2 months ago, but today in this country, the most trusted indoor environment outside of the home or facility that you're quarantining yourself in. And why is that? Because the facility hopefully is doing everything right. They have people studying this and they're doing everything right with the HVAC and disinfection and distancing and one-way aisles and spacing of cubicles and things like that. The second thing is that just like you don't want to bring an illness in and get your coworkers sick, and they don't want to bring an illness in and get you sick. So we all have a common interest in those work environments and protecting one another, and presuming that we all like paychecks. If the company suffers serious setbacks or goes under because too many people are ill and the company can't function, then people lose their jobs as well. So there's a serious common interest at work that's absent at a mall or a store or a market or a place like that. If you are working in a place that's like a warehouse or a shipping facility or an embroidery facility, they're very, very large, right? Typically, they're very well ventilated. They have to be. There's a lot of equipment. They typically have very high ceilings. That's all good. The dilution factor is significant there. And you're typically distanced in those things anyway before the COVID-19 illness struck. So, and there's typically not a lot of talking. So those things are all good for returning to work in those environments. I would, if you have things in your power to do, like talk less, be further apart when you have to talk, be masked up when you have to talk, and keep conversations that are less than 10 feet apart without a mask to an absolute minimum duration. Those are all smart things to do. So your work environment, probably, if it's a good company that understands these rules and is in placing them, is probably the safest place for you outside your home. Now, I periodically will drop a few quotes in here from here on out. This particular physician is somebody who I think is putting out the best information out there at the moment for lay people on understanding all this, and many things in this presentation are based on his work. But the quote here, if you're sitting in a well-ventilated space with few people, the risk is low. Well, that describes the typical office environment unless you're in a conference room. So when in doubt, mask up. I know nobody wants to hear that, but masks are your friend. We'll talk about why that's true in a moment. All right, what about socializing and errands outside of work? So the same physician, in countries performing contact tracing properly, only a single outbreak has been reported from an outdoor environment. Now, unfortunately, in this country, we are not yet doing contact tracing properly. Hopefully, we will be shortly, but there are very few, if any, documented cases of transmission outdoors. Outside is your friend, as I said a moment ago. Infinite air volume for dilution, high air movement for dilution, UV and humidity help, and help very quickly to reduce your risk there. So if you're more than 6 feet apart outdoors, the risk is very low. Now, that doesn't mean it's perfect. You don't want to spend 8 hours 6 feet from somebody who's ill talking in your face the whole time, right? Even if you're only getting one virus particle a minute, over a long enough period of time, you could receive that infectious dose. So when you're in some place you're inherently safer, outdoors, great. I'd still be thinking about how far away am I from that person? What activity are they engaging in and how risky is that? And how long am I there? And if I'm going to choose to be 8 feet apart because we're going to have a beverage of your choice outside on a deck or a patio with some people that you know and trust, well, we're going to do that for an hour. I'm going to choose to be more than 6 feet apart. If we're going to do that for 15 minutes, maybe 6 feet is just fine, or mask up. So the social distancing rules, it's important to understand this. They're really just to protect you from brief exposures like going into a market for an hour. They are not a perfect tool to stop everything. So one more quote from the doctor here. In these situations, there's not enough time, and I'm talking about outdoors or in big box stores, not enough time to achieve the infectious viral load when you're standing 6 feet apart or where wind and the infinite outdoor space reduce viral load. So anyway, you can read that for yourself, but the data and the science do back up the idea that outdoors matters, distance matters even outdoors, duration matters even outdoors. So what about other things you might go do for fun besides having to run errands like get food or medicine? So activities like biking, jogging, walking, hiking, kayaking, they're all thought to be relatively safe if you're more than 6 feet away from others you're doing it around. Whereas things like sunbathing, sitting in a park, going to a concert, are riskier. Well, they're both outdoors, so think for a moment, if you will, about what the activities on the left have in common and what the ones on the right have in common. And they're blue and red for a reason. So activities like biking and jogging, etc., all involve movement, right? You're moving. So by definition, your exposure to any individual person who might be ill is minimized because you're moving. Chances are they're moving too if they're doing something similar. And it's relatively easy if you have to pass somebody in a crowded trail for a moment to either mask up or hold your breath. One tip here. Science is now telling us you might not want to stay behind the same person for too long. If you're running immediately behind somebody, 5, 6, 8, 10 feet, and some studies say as much as 30 feet behind the same person for a long period of time, yes, you have the advantage of movement and infinite dilution. But if they're breathing virus particles out and you're in their contrail, for lack of a better word, it is theoretically possible, hasn't happened yet that we know of, but it's theoretically possible over a long period of time to receive an infectious dose. So please don't stay behind the same person. If you're going at the same pace, pull over for a minute, speed up and pass, and do what you have to do to not stay behind the same person. On the other hand, things like sunbathing or sitting in a park, number one, you cannot control your distance from others. You have plopped down wherever you have, and nothing stops somebody else from plopping down too close to you. And you're around those people for much longer because you're stationary and they're stationary. So if anybody in too close a proximity to you, and especially upwind of you, might be breathing out infectious particles, you're not around them for a second or a few seconds like you might be jogging or kayaking or running. You're around them for minutes or hours. So the longer duration and the stationary nature and the lack of the ability to control who sits next to you or stands next to you are all risk factors. Are you safer outdoors than in? Yes. But are you as safe sunbathing as you would be jogging the beach? Absolutely not. Keep these things in mind. So what about we're doing things indoors? Now, this is where the risk goes up dramatically. Errands require being indoors, right? That's where the market is. So in my case, I would choose a market that is bigger. I might not walk into a local market that's much smaller and boutique-y unless I had to. I would choose a market that doesn't have as many people in it. I would choose a time of day where the people in that market are less dense, right? I would choose a higher ceiling if I had the option. So know this too. In Chicago, in the United States, it is thought that the significant spread of COVID-19 there was primarily due to a few people attending funerals and religious gatherings, birthdays and a few other parties, and then boom, it ran rampant through the city. So why am I bringing that up? Indoor events that are discretionary, as much as you may want to go, pose an enormous risk if the 5Ds aren't being observed. To be indoors if I don't have to, not happening. To be with a whole bunch of other people in a small space where they're talking or laughing or singing and not masked up and touching the same buffet table, not happening in my world. Now, COVID-19 spread from shopping appears to be very, very small. That's what most of us are probably afraid of. I said for weeks, the riskiest thing I do is go to the supermarket because that's what it felt like. Turns out the data don't bear that out. Why is that? Well, the volume of air in these spaces is typically very large, right? They're pretty big stores. Supermarkets tend to be. The number of people these days, hopefully where you shop, is restricted. So the volume goes to your advantage. The number of people goes to your advantage. And how long you're in there isn't all that long. You know, what, 30 minutes, an hour, depending on how much stuff you're getting, where unfortunately the workers are in there all day long. So again, you can see that in a place you have to go, like a market, to get food, bigger is better, fewer people is better, shorter duration is better, and masks are better. So those things are all in your favor, whether it's a market or anything else you're considering doing indoors. What about other activities? Now, restaurants. If you're anything like me, you love restaurants. I certainly do, and I miss them terribly. If they're open in your area or they're about to open, you have to understand the risk there. There is significant risk indoors at a restaurant, even with 6 feet of social distancing. Why is that? Well, restaurants are nowhere near as big as supermarkets, right? They're typically relatively small spaces compared to other indoor options. There's less airflow. By definition, there's typically lots of people talking. They're there to socialize. And you can't eat with a mask on. Your last line of defense is that mask. You can't eat with it on. You can't drink with it on. So on all these levels, it's trouble, plus duration. So remember the dilution, the dose, the lack of a mask, and now the time. Most restaurants, especially if you're there to relax, you're there for an hour or more, which doesn't do good things to the duration aspect. Other things, haircuts, nail salons, things like that. They also require being indoors and close contact with another person. A mask is your friend, but depending on how long you're in there, a 15-minute haircut is one thing. An hour and a half salon visit is entirely different. The duration is 6 times longer, so the risk is 6 times greater. Please keep duration in mind, as well as the other 4 Ds when you're making decisions about what you want to do. So what about masks? I know this is an unpopular subject before I turn to it, but there is new research, and I'd like to share with you why you should be wearing masks at all times, that you cannot control other factors. They do dramatically reduce transmission of COVID-19, both the medical masks and the non-medical masks. And how do they do that? Well, if you can't touch your nose or mouth, then that risk of transmission, that disinfecting thing, is gone. You're not going to touch your nose and mouth when you're wearing a mask in public because you can't. It'll reduce the droplets that you inhale, many of these masks, by as much as 70%. It'll reduce the amount of droplets you exhale. So if you're ill, it will dramatically help other people. Part of this is my mask protects you from me and your mask protects me from you. That's this aspect of things. Masks, even if the person's ill, dramatically reduce the distance traveled by the droplets. Instead of going 3 or 4 or 5 or 6 feet, or if you're coughing or sneezing much further, they're a foot or so tops. They kind of come out the sides of the mask and go down. So on that level, masks are helpful. And they dramatically reduce the droplets that can be deposited on surfaces that then you could touch and pick up. So on all these levels, masks are helpful. How helpful? Where's the proof? Nobody wants to do this. Show me the proof. Okay. One of the gentlemen responsible for discovering SARS, which COVID-19 is, the SARS-CoV-2 is a SARS virus, I believe it was in 2003, recently did research using hamsters. And hamsters are excellent representative stand-ins for humans, unfortunately for the hamsters. And he put mask fabric between infected hamsters and healthy hamsters and used a fan to blow air from the infected hamsters to the healthy hamsters. With no mask fabric between the two, within a week, 2/3, 66% of the healthy hamsters were infected. However, if you put the mask fabric up, and for the healthy hamster population, that infection rate dropped to 33. So if the healthy person is wearing a mask and the infected person is not, the mask cuts your risk of infection in half. That's a 50% reduction in risk. The single most important thing you can do to reduce risk in terms of percentage. What about if the mask was worn by the infected hamster, if you will? They weren't actually wearing little tiny masks, but not the healthy hamsters. Well, then it was down to 16%. That's a 75% reduction in infection. So masks are between 50 and 75% effective at reducing your likelihood of catching this illness. What if both the infected and the healthy hamster enclosures had masks? Well, we don't have that data, but you have to imagine it would be well below 16.7. Masks are your friend. Here's the data that shows it. And one of the most reputable SARS research scientists on the planet, 50 to 75% reduction in your risk of contracting COVID, even if you're right next to an infected person, in this case for as long as a week. Please use your masks when they're appropriate and use them properly. They're PPE, like the arc-rated and flame-resistant clothing that my company deals with every day. These are PPE. They're kind of like a seatbelt. You don't want to be in an accident any more than you want to be around an infected person. But when you are, the seatbelt and the airbag are your last line of defense against fatal or catastrophic injury. So are the masks. When you are out in public and you can't control the distancing because somebody comes right up to you, or how loudly somebody's talking, or some other factor that's out of your control, masks are your last line of defense. They can and will, when properly worn, block between 50 and 75% of the virus particles, dramatically reducing your likelihood of infection. So when any of the 5 Ds, distance, dose, dilution, duration, and disinfection ability, when those are compromised, any of the 5, masks are your last line of defense. Please wear them whenever appropriate. When is that? Anytime you're indoors, in a smaller or more crowded space, or a place with low airflow. If I'm in a private office in a nice office building at work, I probably don't need my mask. If I then have to go out in the hallway, I'm going to wear my mask. If I have to go in a conference room, first of all, I'm going to actively resist being asked to sit in a conference room for more than a few minutes with more than a few people. Let's relocate it to a lobby, but I'm definitely going to wear a mask then. When you go into takeout food or retail establishments, even in big spaces, some of the big box stores, if you're in there for a while, you want to be wearing a mask. A while is more than a few minutes. So kind of by definition, you should have a mask on going into these stores. Outdoors, if you're less than 8 or 10 feet away, you should still probably have a mask on. If you plan on being around somebody outdoors for an extended period of time, less than 8 to 10 feet away. So you're now inside the distance and you're hurting on the duration. So the mask is your best friend in those cases. How do you take care of the masks? Wash them all before you wear them the first time to get anything in, out of there, dyes or finishes that you don't want to breathe in. Sanitize your hands before you put them on so you're not carrying virus particles to your face. Make sure they're worn above the bridge of the nose and below the chin, snug on the sides. A new pet peeve of mine, people who wear their masks down below their nose, it does no good. It has to be worn, folks, has to be up above the nose to be protecting both the wearer and other people. Please wear them properly. Don't touch them. Don't fidget with them all the time while they're on your face. So get ones that fit and are comfortable enough that you're not constantly moving them around and potentially bringing infectious particles toward your face. Taking them off properly is important. You want to undo the top strap first if it's a double strap model and let the top of the mask fall down and away from your face so that the outside surface, which might be contaminated, isn't being pulled up past your nose or isn't hanging around your face. It's falling down and away. And then undo the bottom. And wash them between each wear to both disinfect, washing will disinfect, and to make sure that the mask is clean just from a sanitary standpoint to breathe through. So what's a good procedure? You go out into public, you're safe, you're clean. Now you're going to go into public. You leave your car in your house to walk into whatever public space. The procedure that works sanitization-wise, disinfection-wise, get back in your car having touched only the door handle. Disinfect your hands immediately with sanitizer or wipes that you hopefully have in your car. And don't forget things you might have handled while you were out in public, like your car keys, your cell phone, your glasses, reading glasses, anything like that that may have virus particles on them. Disinfect them, and now, before you touch anything else in your car besides the handle, now the car, assuming you disinfect the handle, is a safe space as well, and you don't have to disinfect the whole inside the car every time. And then obviously, don't touch your hands to your face till they're disinfected. When you go to come inside your house, should you wash your hands again, even though you disinfected them in the car? That's up to you, but I choose to do it. It can't hurt. It's 20 seconds of my life. What about disinfecting items you bring inside? Many people for a while now have been disinfecting groceries. There's mounting evidence that that is not necessary. I can tell you that I continue to do so with anything that's plastic or metal. The paper and cardboard, not so much, but anything that might have been handled by a number of people, I am disinfecting as I bring it into my house. Washing your hands with soap and water, we know works. Disinfect high-touch surfaces in your house. You can do that daily, weekly, or not at all. It's up to you. But in my case, about once a week, I will go through and disinfect the high-touch surfaces just to be safe. So what are your weapons against this virus? Your weapons against this virus we've talked about over and over. Time, chemical sanitizers and soap and water. The virus will dry out on its own if given enough time. Now, that time depends on many, many factors, including whether it's outdoors or indoors, sunny or cloudy, what kind of surface it lands on. Copper is naturally virucidal, meaning that it will die very quickly. It will become non-infectious very quickly on copper. But data says 3 days, and some data says up to 7, but time is on your side. So some people will just let a mask sit a week between uses, knowing that at that point it's disinfected. Sanitizers obviously are on your side here. Bleach, isopropyl alcohol, ethanol, Lysol, etc. we know destroy the virus, but they might not be appropriate for all surfaces, so you have to be careful what disinfection product you use on what surface. And please don't use chemical sanitizers on a mask you're then going to breathe through. Use soap and water. And soap or detergent and water are also excellent. And I'm going to bore you with a minute of science just so that you have the confidence to do the right thing moving forward. Soap and water, believe it or not, are more effective, not just as effective, more effective at destroying the COVID-19, the virus that causes COVID-19, which is SARS-CoV-2. Soap and water are as effective or more effective than chemical sanitizers like bleach and alcohol at destroying the SARS-CoV-2 virus particle. How do they do that? Remember this chart from the beginning of our talk here? Well, that lipid shell becomes really important. So let's take a look for a minute at what a soap molecule does to that lipid shell. So soap molecules have two ends to them, a head and a tail, and I'll oversimplify, but the head loves water and the tail loves fat. Well, that lipid shell of the virus particle, the Viron, is fat, it's lipid. So the tail of these soap molecules loves that lipid and it attaches to them. And the head loves water, so it attaches to that. So you can imagine all these little soap particles or detergent particles attacking a Viron of SARS-CoV-2, and the soap particles stick to one end, the lipid shell, and the other end of it sticks to the water. And then what happens? Well, as you use mechanical action to scrub your hands, or your agitator and your washer does the same thing, those soap particles act like little crowbars and they bust open, for lack of a scientific term, the lipid shell of that Viron, that virus particle, and that essentially kills it. Now, they're not really alive, but you're disinfecting, destroying, deactivating, rendering non-infectious, pick your term. But you're wrecking that SARS-CoV-2 Viron, and it's no longer infectious. Now, chemical sanitizers can do that too. Soap and water does it every bit as well. But soap and water do 3 things chemical sanitizers don't do that are all your friends. Number 1, they will surround the particles that remain, the tail in and the head out with the water. That's kind of what bubbles are. So they'll break the bond. I neglected to mention, these soap and water will help break the chemical bond that allows these particles to stick to you before you transfer them to your face. So that's good. It's broken that bond. It's destroyed the particle. Then they'll envelop those particles and they'll wash them away. So they don't just destroy the particle, which the Viron, which chemical sanitizers can do as well. They also break the chemical bond with your skin. They envelop the particles that remain and they flush them away. All 4 things to your advantage. Soap and water work. Now, that brings us close to the end of our time. If you'd like further reading, I'll just leave this slide in here. There's some links to articles that were used and research behind them for much of the information that's in this presentation. And I'll wrap it up and leave you with the last thought here. The bottom line on safety, keeping yourself and your family and your coworkers safe in this thing, again, for the last time today, infection, your risk, equals what you're exposed to and how long you're exposed to it. The 5 Ds of COVID-19, 6 feet or more of distance. 6 feet is a minimum, folks. The dosage, know what the person or people you're around are doing and its risk factors, nose breathing, mouth breathing, talking, singing, yelling, coughing, sneezing, right? The dilution factor, outdoors or indoors, big space or small space, well ventilated or not, how long you're around them, and your ability to disinfect from surfaces. If you're keeping these 5 things in mind all the time as you move into the public and make decisions about what to do and for how long to do it, you will be vastly more likely to be safe. Staying safe indoors, the bigger the space, the better the ventilation, the better, the fewer the people, the better, and the less time, the less talking, the better, and of course, masks. Masks are your best tool when everything else fails. They cut the virus particles you are likely to inhale in half, and potentially greater than that. So again, if you're wearing that mask, wear it when you're supposed to. Don't touch it. Wash your hands afterward and disinfect surfaces often. That's my time. I appreciate yours. I hope you found this information helpful, and stay safe out there.